Have you ever spent good money on a bottle of prostate supplements, only to wonder weeks later if it was doing anything at all? You are not alone. Every year, millions of men over 60 search for relief from frequent urination, weak flow, and sleepless nights. The promise of a natural pill feels comforting, but the truth is that not all supplements live up to their claims. Some, like saw Palmetto, have been studied for decades yet still deliver inconsistent results. Others sound promising in theory but lack solid scientific backing, and in many cases the real problem is not only the supplement itself, but also the poor quality and misleading marketing behind it. In today's video, we're going to separate fact from fiction. You'll discover which prostate supplements show some evidence of benefit, which ones are little more than wasted money, and what safer natural options you can trust instead. Now let's begin by asking a simple question. Why do so many men turn to supplements in the first place? For most men, the journey toward supplements begins with frustration. The symptoms of an enlarged prostate can creep in slowly, waking up 2 or 3 times a night, struggling with a weak or hesitant stream, or feeling embarrassed by sudden urgency during the day. These changes are not just inconvenient. They interrupt sleep, sap energy, and create anxiety about losing independence. Over time, men start looking for answers that feel safe, simple, and easy to manage on their own. That search often leads to supplements. The idea of a natural pill is appealing because it promises relief without the stigma of prescription drugs or the fear of surgery. Advertisements use reassuring language. Supports urinary health, clinically tested, ancient herbal remedy. For a man who just wants to get through the night without multiple bathroom trips, the promise feels too good to pass up. At the same time, the supplement industry has exploded. Shelves at pharmacies and online marketplaces are packed with dozens of products, each claiming to be the breakthrough solution. The reality, however, is that quality is far from consistent. Independent studies have shown that some supplements contain only a fraction of the active ingredient listed on the label, while others are padded with fillers. This lack of regulation makes it difficult for men to know what they are truly buying. I remember a patient, a 64-year-old named James, who spent hundreds of dollars over the course of a year trying different prostate supplements. One month it was saw Palmetto, the next it was pumpkin seed extract, and later it was a mix of exotic herbs he had never heard of before. Despite the cost, his symptoms hardly changed. His story is not unique. Many men find themselves cycling through bottles, hoping the next one will be different. This raises the critical question: which supplements, if any, actually deliver results, and which are just clever marketing? To answer that, we need to start with the most famous name in prostate health, saw Palmetto. Saw Palmetto, myth or reality? Among all the prostate supplements on the market, none is more famous than saw Palmetto. This small berry, native to the southeastern United States, has been used in traditional medicine for centuries. Native American tribes once relied on it to treat urinary and reproductive problems, and over time it became one of the most widely marketed natural remedies for men's health. Even today, walk into any pharmacy and you will almost certainly see a bottle of saw Palmetto capsules promising relief from urinary symptoms. Early studies seem to support the legend. In the 1990s, small clinical trials suggested that saw Palmetto could reduce nighttime urination, improve urinary flow, and relieve discomfort. For men desperate to avoid prescription drugs, the idea of a plant-based solution felt empowering. Doctors and patients alike began to hope that this simple berry could stand as a natural answer to prostate troubles. But as larger, more rigorous trials were conducted, the picture changed. One of the biggest studies, involving more than 3,000 men, found no significant difference between saw Palmetto and a placebo. In other words, men taking saw Palmetto did not improve more than those taking a sugar pill. other trials reached similar conclusions, showing that the early promise was not as strong as many had hoped. The problem does not stop there. Quality control is a serious issue. A detailed investigation of saw Palmetto products revealed that many capsules on store shelves contained far less of the active ingredient than the labels claimed. Out of 27 products tested, only 7 met proper standards. That means a man could be taking what he thinks is a therapeutic dose, when in reality he is swallowing little more than filler. This lack of consistency makes it almost impossible to guarantee results. So where does that leave us? The truth is that saw Palmetto may still help some men. A few patients do report fewer nighttime trips and a slightly stronger stream. But the evidence shows that these benefits are not reliable, and the results vary from person to person. Saw Palmetto is not dangerous when used correctly, but it is far from the miracle cure that marketing often suggests. The lesson here is clear. While saw Palmetto has history and some hopeful stories, it is not a magic bullet. It may be worth a cautious trial under a doctor's guidance, but it should never replace proven medical care or give false hope of guaranteed relief. With that in mind, let's look beyond saw Palmetto to the other supplements men commonly try, from beta-sitosterol to pumpkin seeds, and see whether any of them stand up to the promise. Other popular supplements. After saw Palmetto, many other supplements have gained attention in the fight against prostate problems. Their names appear on bottles across pharmacy shelves, often packaged with bold claims of supporting urinary health or reducing nighttime trips. Some of these supplements have shown small benefits in research, while others remain questionable. Let's take a closer look at the most common ones. Beta-sitosterol is a plant compound found in many fruits, vegetables, nuts, and seeds. Some studies suggest that it can improve urinary flow and reduce the feeling of incomplete emptying. Men who took beta-sitosterol reported stronger streams and less frequent urination compared to those on placebo. However, the problem is that the data is limited to short-term trials. We don't have strong evidence showing that beta-sitosterol works consistently over many years, or that it prevents the prostate from enlarging further. At this stage, it seems promising but incomplete. Next is Pygeum africanum, an extract made from the bark of the African plum tree. It has a long history in traditional medicine, especially in Europe, where it has been used to ease urinary problems. Research has shown that Pygeum may reduce symptoms like urgency, frequency, and nighttime urination. Men taking Pygeum often reported feeling more comfortable and less disturbed at night. However, most of these studies were small, short in duration, and not always well controlled. That means, while Pygeum may help some men, the quality of evidence is not yet strong enough to guarantee reliable results. Another popular choice is pumpkin seed extract. Pumpkin seeds are naturally rich in zinc and phytosterols, both of which play important roles in prostate health. Zinc supports the immune system and hormone balance, while phytosterols may help reduce the growth of prostate tissue. Several small studies have found that pumpkin seed extract can reduce nighttime trips to the bathroom and improve overall symptom scores. One of my patients, a 65-year-old named George, decided to try something simple: roasted pumpkin seeds at home. Instead of buying expensive capsules, he added a small handful of seeds to his evening snack 3 times a week. Within 2 months, he noticed that he was sleeping more soundly and waking up less often at night. His experience doesn't prove that pumpkin seeds work for everyone, but it does show how natural foods can sometimes deliver meaningful comfort without complicated routines. Then we have stinging nettle, a plant that is often combined with saw palmetto in supplement formulas. Alone, nettle root has shown mild improvements in urinary symptoms, though the effect is generally modest. When used together with saw palmetto, some studies suggest a stronger benefit, possibly because the two herbs work on slightly different pathways. Still, the evidence is mixed, and like other supplements, quality and consistency remain concerns. Finally, let's talk about lycopene, the antioxidant found in tomatoes and watermelon. Lycopene has been studied for its potential to reduce oxidative stress and lower levels of dihydrotestosterone, the hormone that drives prostate growth. Men who consume lycopene-rich foods often have lower risks of prostate problems. The important point, however, is that lycopene seems to be more effective when it comes from food rather than pills. Cooked tomatoes, tomato sauce, and tomato soup deliver a concentrated form of lycopene that the body can absorb more easily. Watermelon offers an additional source, especially during summer months. While lycopene supplements exist, research suggests that real food is the better choice. When we step back and look at all these supplements, beta-sitosterol, Pygeum, pumpkin seed extract, stinging nettle, and lycopene, a clear pattern emerges. Most of them show some potential, especially in small, short-term studies. Some men do feel better when they take them, but the evidence is uneven, and the benefits are usually mild. None of these supplements have been proven to shrink the prostate dramatically or cure the symptoms of BPH. At best, they offer small improvements. At worst, they drain a man's wallet without much change at all. The bottom line is this: supplements may provide modest relief for certain men, but they are not miracle cures. The science is still developing, and results are far from guaranteed. If you decide to try them, do so with realistic expectations, and always remember that food, exercise, and medical care remain the pillars of prostate health. In the next section, we'll explore the hidden risks and limitations of prostate supplements, including why natural does not always mean safe, and how poor quality control can sometimes turn hope into harm. Risks and limitations of supplements. When men see the word natural on a bottle, it feels reassuring. The label suggests safety, purity, and healing. But in reality, the world of prostate supplements is filled with risks and limitations that every man should know before spending his money or trusting his health to a capsule. The first problem is quality control. Unlike prescription drugs, supplements are not strictly regulated. That means the ingredient list on the label may not match what is inside the bottle. In fact, studies have tested Palmetto products from different brands and found that many contained only a fraction of the active ingredient promised. Some bottles had so little of the plant extract that they could not possibly deliver an effect. For the consumer, this inconsistency makes it nearly impossible to know whether you are getting a therapeutic dose or just powdered filler. Another concern is drug interactions. Many older men already take medications for blood pressure, diabetes, cholesterol, or heart disease. Adding a supplement into the mix can sometimes interfere with how those medicines work. For example, some herbal extracts may thin the blood, raising the risk of bleeding when combined with anticoagulants. Others may affect liver enzymes, changing how drugs are processed. Without proper medical guidance, a supplement that seems harmless can quietly create dangerous complications. It is also important to remember that natural does not mean safe. Botox is a natural toxin produced by bacteria, yet in large amounts it is deadly. The same principle applies to prostate supplements. While a plant-based capsule may look gentle, its compounds can still cause side effects or strain the body in unexpected ways. Dosage is another issue. Many men assume that if a little helps, more must be better. But high doses of certain supplements can lead to digestive upset, diarrhea, or headaches. Some men even report feeling dizzy or unusually fatigued. The problem is that dosage guidelines are not always clear, and with unregulated products, 2 bottles may deliver very different strengths, even when they appear identical. I recall one patient, a 70-year-old named Michael, who became convinced that combining multiple supplements would give him the best chance of relief. He was taking Palmetto, pumpkin seed extract, and stinging nettle all at once, along with his regular medication for high blood pressure. Within weeks, he began experiencing stomach cramps, nausea, and dizziness. Eventually, his doctor advised him to stop the supplements, and the symptoms disappeared. Michael learned the hard way that mixing too many products can overload the body and create new problems. All of these risks highlight the need for caution. Supplements are not evil, but they are not magic either. The lack of regulation, the potential for drug interactions, and the unpredictable side effects make them tools that must be used carefully. For some men, they may bring modest relief. For others, they may bring nothing but wasted money and unnecessary discomfort. As we move forward, the question becomes clear. If a man wants to try supplements, how can he make a smart choice and avoid disappointment? That is exactly what we will explore next. Practical guidelines for choosing wisely and protecting both your wallet and your health. How to choose wisely if you want to try. After hearing about the risks and mixed results of prostate supplements, many men still ask, but what if I want to give them a try? How can I do it safely? That is a fair question, and the answer is not to avoid supplements entirely, but to approach them with wisdom and caution. There are several practical steps every man should follow before spending his money or risking his health. The first and most important step is to talk with your doctor. This is especially true if you are taking medications for the heart, blood pressure, or diabetes. Even though supplements are sold over the counter, they can still interact with prescription drugs. A quick conversation with your physician or pharmacist can help identify any hidden dangers. Remember, your doctor is not there to sell you pills. They are there to protect you from complications. A 5-minute discussion could prevent months of unnecessary problems. The second step is to look for independent certification. Because supplement quality varies so much, choose products that have been tested by trusted organizations such as USP, NSF, or Consumer Lab. These groups do not guarantee effectiveness, but they do verify that what is on the label is actually in the bottle. This simple check can help you avoid paying for a capsule that contains little more than filler. Third, start low and go slow. If you decide to try a supplement such as saw palmetto, pumpkin seed extract, or beta-sitosterol, begin with the lowest recommended dose. Pay close attention to how your body responds over the course of several weeks. Are you experiencing less urgency? Are you sleeping through the night with fewer interruptions? Or are you noticing stomach upset, headaches, or no change at all? Keeping a simple journal of your symptoms can help you decide whether the supplement is worth continuing. Fourth, do not rely on supplements alone. Even the best products cannot replace a healthy lifestyle. Maintaining a proper weight, eating more vegetables and lycopene-rich foods, staying active through walking or light exercise, and avoiding excess caffeine or alcohol are still the most reliable ways to support prostate health. Supplements may play a supporting role, but lifestyle is the foundation. Think of it like building a house. A supplement can be a window or a door, but without a strong foundation of daily habits, the structure will not stand. Finally, set realistic expectations. Supplements are not miracle cures. At best, they may provide mild to moderate relief for some men. At worst, they may do nothing. Going in with clear eyes prevents disappointment and helps you make balanced decisions. If you notice no improvement after a fair trial period, usually 3 months, it may be time to stop and save your money. The wisest approach is one that combines medical guidance, careful product selection, modest dosing, and healthy living. With these steps, you reduce the risk of harm and increase the chance of finding something that truly benefits you. And now I want to hear from you. Have you ever tried a prostate supplement? Which one was it, and what was your experience? Share it in the comments below so that other men can learn from your journey. Your story might help someone else avoid a mistake or discover a helpful tool. Next, let's bring everything together with a clear conclusion, where we'll separate hope from hype and leave you with a message of confidence and direction. As we finish this journey, the truth about prostate supplements becomes clear. Men turn to them out of frustration, tired of weak streams, sleepless nights, and the fear of losing independence. The promise of a natural pill feels safe and simple, yet reality often tells a different story. We saw that Palmetto, the most famous supplement of all, carries a long history and plenty of marketing, but large, well-designed studies show little difference compared to a placebo. Other supplements, from beta-sitosterol and Pygeum africanum to pumpkin seed extract, stinging nettle, and lycopene, each offer small glimmers of benefit, but the evidence is limited and inconsistent. Some men notice improvement, others see no change at all. The bigger risks come from poor quality control, drug interactions, and the false sense of security that natural always means safe. Without proper guidance, men can end up spending hundreds of dollars, mixing multiple products, and sometimes even harming their health in the process. So what is the wise path forward? Supplements can be tried cautiously, but never as a substitute for medical care or healthy living. If you choose to experiment, do it the smart way. Talk with your doctor, look for independent certification, begin with a low dose, and track your results honestly. And above all, build your foundation with proven habits, maintaining a healthy weight, eating more vegetables and cooked tomatoes, walking every day, and managing stress. The message I want to leave with you is this: relief does not come from chasing miracle pills, but from informed choices and consistent self-care. A supplement may give you a small boost, but your daily habits and medical guidance are what truly protect your prostate. If you have tried any prostate supplement, share your experience in the comments. Your story might save another man from wasting his money or encourage him to try something in a smarter way. And if you found this video helpful, subscribe, like, and share it so more men can find the truth they deserve. Remember, your health and vitality are worth protecting, and with the right knowledge, you don't have to walk this path in confusion or fear.